Good evening. I'd like to welcome you and thank you for joining me here tonight. My name is Liz Tolles, and tonight I'm going to be talking about blood sugars and how to test them in a person with type 1 diabetes, and why good glucose control can help improve quality of life in a person with diabetes. The Canadian Diabetes estimates that there are 9 million Canadians currently living with diabetes, and of that, 10% of those have type 1 or insulin-dependent diabetes. It has been estimated that the life expectancy for someone with diabetes can be reduced by approximately 15 years. In the Globe and Mail's June 2013 edition, they reported that in 1996 there was an 11-year reduction in life expectancy for someone with diabetes, and that has since dropped to a 6-year reduction in 2009. These shorter life expectancies are usually an indirect cause of poor or uncontrolled blood glucose levels, and the long-term complications of hyperglycemia are essentially damage to the vessels that supply blood to the heart, the kidneys, the eyes, and the nerves. As the mother of a child who diagnosed with type 1 diabetes very early on at 8 months of age, it saddens me to know that her life could be shortened because of this uncurable and unpreventable disease. But I do also know that with proper management, combined with a healthy lifestyle and exercise, her chances at a long and healthy lifestyle will be greatly improved. So first, throughout this presentation, I'm going to be talking about some of the long-term complications of uncontrolled blood glucose levels. I'm going to talk about the immediate threats of a low blood glucose level, some of the things that affect blood glucose levels, when to test, what to do when that test number is outside the normal range, and then along with my very helpful assistant tonight, we're going to give a live demonstration of a blood glucose test. So first of all, let's talk about high blood glucose levels and some of the complications that can arise with this. Mayo Clinic diabetes educators Nancy Klobasa and Peggy Moreland, who are both RNs with the Mayo Clinic, put it this way, and I quote, "Blood sugar coats the red blood cells, known as hemoglobin, causing them to become stiff. Then these sticky cells interfere with blood circulation, causing cholesterol to build up inside of the vessels. And it can take months to years for the damage to show up in the body, but it usually affects the fragile blood vessels of the eyes, the kidneys, and the feet. This can result in complications such as cataracts, glaucoma, retinopathy, kidney disease, and an increased risk of heart attack and stroke." The short-term complications of diabetes are equally as frightening and can include things such as seizures, coma, and fatality if left untreated. So let's talk a bit about what is a normal blood sugar, and then I'm going to give you some examples of what causes fluctuation in the blood sugar. So I've handed out a handout, and if you flip to page 2 on your handout entitled Managing Your Blood Glucose, and this is published by the Canadian Diabetes Association, on page 2 you'll see a chart at the bottom. So what is defined here as a normal blood glucose level is anything between 4 and 7, and these are the levels before meals. And after meals, you're shooting for a range of between 5 and 10, and this is measured in millimoles per liter. These are based on the Canadian Diabetes Association's 2013 clinical practice guidelines, but every person is very different, so everyone should check with their own healthcare provider to figure out what range is normal for them. So what are some of the things that affect blood sugars? Well, first and foremost is what we eat. It's a common misnomer that it's sugar that affects blood sugar levels. This is not true. What actually affects blood sugar levels are carbohydrates, and this happens almost immediately after you consume carbohydrates. So some foods that are high in carbohydrates include pasta, potatoes, bread, fruit, and fruit juices. And some things that are very low in carbohydrates or contain zero carbohydrates are any kind of meat, cheeses, and other low sugar dairy products, most vegetables, and any kind of fats. Some other things that can affect or cause fluctuations in blood glucose can be activity levels. Generally, the more active you are, the more your blood sugar level will come down. Second thing can be stress and illness, and both of these things will cause blood glucose levels to rise. Thirdly, too much or too little insulin. You want to be very careful that insulin levels are matched with the carbohydrate intakes, and this will help keep you inside that normal range of 4 to 7. Our bodies require glucose 24 hours a day. So during the night when we're not eating or we're fasting, the blood glucose levels in the body start to drop. And at this point the liver releases something called glucagon, which will bring blood sugars back up. And the fifth thing that can affect blood sugar levels is alcohol consumption. So when should you test blood sugars? Firstly, you want to test them first thing in the morning when you wake up, before you've had anything to eat, and before meals. Second time is you want to test after meals and before bedtime. And what this will do is let you know if you're matching the right amount of insulin to your carbohydrate intake and if you're eating the right kinds of foods. You want to test before operating any kind of heavy machinery or driving. And if blood sugar is low, at this point it's a good idea to consume a high carbohydrate snack to bring those blood sugars back up. You want to test before, during, and after exercise to see how the exercise is affecting your blood sugar levels. And you just want to test whenever you feel odd. So our rule of thumb around here is when in doubt, test. Now kids in particular are not always able to communicate whether they're having a high or low, and they sometimes don't recognize the symptoms of either. So it's a very good idea for the caregivers to know the symptoms as well. So I've created a short PowerPoint here which is going to outline some of the symptoms of a high blood sugar and the low blood sugar and how to treat both. So some warning signs of a low blood sugar. The person may be sweaty, they may be weak or tired, they may indicate that they're hungry, they may be very shaky, a fast heartbeat, be anxious or nervous, feel nauseous, or tingling in their extremities. Some other things they may exhibit are difficulty thinking and concentrating, difficulty speaking, and you'll actually notice slurred speech when someone is low. They can be drowsy, experience vision changes, confusion, headache, dizziness. They may appear like they're drunk. They might be irritable, clingy, you'll notice big personality changes, and they might get angry with you or cry. How to treat a low blood sugar, and that's anything that's less than 4 millimoles per liter, is to immediately give the person some juice or something sweet that's quickly absorbed. We will use a juice box in this example. And you'll know that the blood sugar is starting to come up because the person will perk up like a wilted flower. So I'm going to make sure you test again in 15 minutes to make sure that the blood sugar has increased above that 4 millimole per liter range, and if not, treat again. Some signs of a high blood sugar can be increased thirst, lots of trips to the bathroom, fatigue, grogginess, increased appetite, or the inability to concentrate. And what helps bring a high blood sugar down, other than insulin, the only things you can do are just get out and get some exercise, munch on some low carbohydrate snacks, and drink lots of water. High blood sugars are not good over the long term, but they are no immediate threat in the short term. So some examples of some low carb snacks. Pretty much any kind of vegetable here, and any kind of meat. Peanut butter is a good one. Peppers, cucumber, and then of course just lots of water. Okay, so I'm going to call on my lovely assistant, Peyton, to come up, and we're going to give you a live demonstration of how to test blood glucose levels. So first of all, we want to gather all of our equipment, and for us that consists of our test strips, our meter, what else have we got in here? Our lancing device. The device that we use for lancing actually has a barrel inside with 6 lancets in it, so we don't have to change this as often. Some might require a new lancet every time. So first thing we want to do, which Peyton has already done, is wash her hands. And if you are somewhere where you can't get to some soap and water, these alcohol swabs are very handy. You can get these at Costco. And then you want to... Do you want to do this part? Yeah. Okay, so then we're going to put the test strip into the meter. And then when this is ready to go, then we're going to get our lancing device ready to go. Ours is simply push it in, then it's loaded, ready to go. And we're going to do now is prick the side of her finger, and you want to aim for the side here because there's a lot of nerve endings in the sensitive pads of the fingers that we don't want to damage, so always along the side. So we're going to do a little poke, and give it a good squeeze till you get a nice droplet of blood, and you're going to take your strip and just touch it to that blood, and fairly quickly we'll have a reading here. And 8.7 we're at, which is actually a pretty good number for us. So then you're going to dispose of this strip. I'll get you to do that, thank you my lovely assistant. And put your equipment away. And then before you forget, you want to write down your numbers so that you've got a log of, just so you can keep track of trends and blood sugars and anything else like that. So, in conclusion, the key to good blood glucose control is testing frequently and at regular intervals, and then knowing how to react to those numbers to bring those numbers back inside that normal range. Tight control of blood sugars will ultimately lead to an improved quality of life and can help prevent and delay any complications related to diabetes. I'd like to thank you for your time tonight, and if you have any questions, I'm happy to answer them at this time.